So know your numbers week is obviously very important to us. We always work towards it. We run the blood pressure campaign all throughout the year, but when it comes to know your numbers week, we have posters up, we inform the surgeries, we speak to our patients as and when they come in, make sure that people are aware of this week and aware of the BP numbers. And it's just something that we can anchor in on, say it's know your numbers week, so do you actually know your numbers? And we just try to raise awareness of what blood pressure checks can do for people, how we can prevent strokes, how we can prevent heart attacks, especially if they've got a family history of high blood pressure. So it works really well and people actually do listen. As we're checking prescriptions, we will identify patients who are over the age of 40 who aren't on any blood pressure medication or haven't been diagnosed as hypertensive or have not had their blood pressure checked done at them for surgery. And when they come into the pharmacy, we'll ask them if they want their blood pressure checked. It's all free, of course, and it takes 5 minutes maximum. Once we've done the blood pressure, if the blood pressure is identified as high, then we will offer them an ABPM, which is a 24-hour blood pressure monitor that they can put on their arm. It's very non-invasive, very easy to use. They keep that on for 24 hours and then bring it back in, and we can then have a look at their results and see if they actually are if they have got hyperpressure, or whether it was just high because it was during the day and they might have been rushing around, could have been too hot, etc. So it just gives us a bit more of an accurate reading of what their blood pressure is. If it's still high, then we would refer over to the GP and let them take over. And through this service, we've actually caught a number, I don't know the number off the top of my head, but we have actually found patients who are actually hypertensive that didn't know they were hypertensive, because a lot of people, if they're not on medication, don't go to the GP surgery to get a regular blood test or a regular blood pressure check or a HbA1c check. And we've identified quite a number of patients, and through that, hopefully, we've prevented heart attacks, strokes, etc., etc.